Okay, everyone, I'm going to get started. My name is Bethany Rose. I'm a policy analyst with NACUI, and this afternoon our webinar is going to be on the premium subsidies made available under the Affordable Care Act for American Indians and Alaska Natives, and how these interact with the health insurance marketplace, which launches on October 1st. Understanding the Affordable Care, So here's an overview of exactly what we're going to cover this afternoon. First, it's important that we understand what the Affordable Care Act is and understand the definition of Indian within the ACA. Second, we're going to go over the benefits and premium subsidies for American Indians and Alaska Natives in the health reform bill. We're going to focus on what premium subsidies are and cover the premium assistance subsidies and cost-sharing assistance available. Next, we're going to cover what the health insurance marketplace is, the types of plans available, and how those with low to moderate income can get the most out of the marketplace and what's available for them. Finally, we're going to alert you to some places for finding answers and assistance on these topics. So, understanding the Affordable Care Act is important, and we're going to cover the basics. It was passed in March of 2010, and in it, the Indian Health Care Improvement Act was permanently reauthorized. The Indian Health Service now has the authority to establish expanded services. The expanded services of IHS include behavioral and mental health treatment and prevention, long-term care services, dialysis services, and urban Indian health programs. The ACA creates competitive pricing for quality health care through the marketplace. You might have heard of these as referred to as exchanges, and that's exactly what the marketplace is. Starting on January 1st of 2014, insurance plans will change. They're never gonna be able to deny you coverage, charge you a higher premium, or sell a policy that excludes coverage of the essential health benefits because of a pre-existing condition. According to Families USA, almost 26% of American Indians and Alaska Natives could be denied coverage without this provision. Health plans will also no longer be able to impose lifetime or yearly limits for these essential health benefits. The definition of Indian is not the same as the existing definitions used by Medicaid and by IHS. While this doesn't mean that the definition will impact these definitions or change those qualifying for the programs at all. This strictly applies to the provisions in the Affordable Care Act. So in order to change the definition in the Affordable Care Act, it's going to require legislative action. The Department of Health and Human Services, HHS, is providing technical assistance to Congress regarding the alignment of the definitions. The good news is that even if you aren't a member of a federally recognized tribe, the hardship exemption is in place to ensure that American Indians and Alaska Natives will be exempt from the shared responsibility payment, and that begins in 2014 and increases in 2016. If you don't automatically qualify, make sure that you apply for a waiver asking not to pay. First, one concern that many individuals have is the shared responsibility payment, which begins in 2015. Many American Indians and Alaska Natives will not face this payment for not having health coverage. If they are a member of a federally recognized tribe or are eligible for the hardship exemption, they will not have to pay this penalty. Any other insured individuals will face this payment if they're uninsured. American Indians and Alaska Natives will have access to special monthly enrollment periods through the marketplace, and they won't have to wait until general open enrollment periods occur. IHS and urban Indian organizations are considered the payer of last resort for services provided to American Indians and Alaska Natives. So in many states, Medicaid eligibility will be expanded to individuals with incomes up to 138% of the federal poverty level, which is about $15,000 a year for a single adult. Families USA estimates that nearly 274,800 non-elderly American Indians and Alaska Natives will be eligible for premium tax credits through the marketplace. The Indian Health Service was permanently reauthorized, as I mentioned before, and has the authority to expand and continue to provide health care services to the American Indian and Alaska Native populations. More than half of these individuals receive care from the IHS currently. Okay, so let's go over what the premium subsidies are for American Indians and Alaska Natives. First, premium subsidies exist in the Affordable Care Act to make sure that health insurance is affordable for everyone who purchases it. There's two types of assistance that we're going to cover this afternoon. First is premium assistance tax credits, which lower the premium amount that a family or an individual has to pay. Second, we're going to go over cost-sharing assistance, which limits a person's out-of-pocket costs and will reduce other cost-sharing requirements like coinsurance, deductibles, and copayments. And we're also going to cover the Medicaid expansion. Premium assistance subsidies are only available if someone purchases a plan through the health insurance marketplace. These subsidies are going to be determined on a sliding scale based on income and the poverty level. A family of four with an annual income between $23,550 and $94,200 qualify for this tax credit. The credit itself is based on the cost of a premium for a benchmark plan. So in this case, that means the second lowest costing plan in the silver category will be available to you. This doesn't mean that you're required to purchase a silver plan. You can purchase a gold, a platinum, a bronze plan, whichever, but the difference will be covered by the individual or the family that purchases the plan. If you apply for this tax credit, you can choose how much advance credit payments to apply to your monthly premiums up to a maximum amount. So if the amount of advance credit payments you receive for the year is less than the tax credit is due, you'll get the rest back as a refundable tax credit when you file your federal tax return. However, if your advance payments are for more than the amount of your credit, you have to pay back the excess payments in your tax return. So unlike many subsidies, though, this tax credit can be paid directly by the federal government to your insurer. This table illustrates how the subsidies are determined on a sliding scale. Since these subsidies interact with your income and the cost of the benchmark plan, it's not possible to give a specific dollar amount right now, and it's going to vary from state to state. Premium assistance limits apply to those making up to 400% of the federal poverty level. For example, individuals making between 133 and 150% of the federal poverty level will have a premium limit set somewhere between 3 and 4% of their income. Meanwhile, individuals making between 250 and 300% of the federal poverty level will have their premium set somewhere between 8.05% and 9.5% of their total income. There's no cost sharing for eligible American Indians and Alaska Natives who receive care through urban Indian health programs or the Indian Health Service. There's also no cost sharing for eligible American Indians and Alaska Natives that earn less than 300% of the federal poverty level and receive care at any health facility. Cost sharing subsidies cap the total out-of-pocket spending for an individual or a family. Individuals with incomes that are lower than 400% of the federal poverty level will get subsidies to lower these caps. And these limits are based on limits that apply to high deductible plans used with health savings accounts, which are often referred to as HSAs. This table illustrates the out-of-pocket spending limits that I mentioned previously based on income and their relationship with the federal poverty level. For those earning between 100 and 200% of the FPL, there's a 1/3 HSA limit of $1,983 as an individual or $3,967 as a family. Those earning anywhere between 2 and 300% of the federal poverty level have their out-of-pocket costs capped at half of the HSA limit. That means that an individual is capped at $2,975 and families are capped at $5,950. And so those who earn between 300 and 400 have their out-of-pocket limit capped at 2/3 of the HSA limit, which is $3,967 for an individual and $7,933 for a family. So anyone who is earning above 400% of the federal poverty level has theirs capped at 100% of the HSA limit, which is $5,940 for an individual and $11,500 for a family. So healthcare.gov is the hub for consumers who are trying to understand and enroll in the marketplace. So it's currently up and running, and they add additional content on a regular basis. So right now, consumers can find answers to many of their commonly asked questions and learn more about how healthcare reform impacts them and their family. On October 1st, families, individuals, and small businesses will be able to compare, choose, and enroll in a plan. And it's important to note that even though you can sign up as early as October 1st, coverage cannot begin until January 1st, 2014 at the earliest. When you use the marketplace to pick a plan, it's going to provide you with information about CHIP, Medicare, and Medicaid if they are qualified for it. One of the biggest advantages to the marketplace is that because consumers will be able to view plans side by side, insurers are going to be encouraged to price their plans competitively. And so finally, when we talk about the health insurance marketplace, in a general way, you should know, depending on your state, your marketplace will be different. Healthcare.gov will direct any consumers to the appropriate website if it isn't the federally facilitated marketplace in their state. Right now, the site won't allow anyone to enroll in plans on October 1st, but you can create an account right now and begin to prepare for enrollment. There's also a call center available through healthcare.gov that's open 24/7, and it's there to help you through any questions that you might have about the marketplace and health reform in general. So when we talk about the plans in the marketplace, it's important to know what actuarial value is, and it's the share of healthcare expenses the plan covers for a typical group of enrollees. The categories of plans available in the marketplace are bronze, silver, gold, and platinum. The plans are put into corresponding categories based on the percentage the plan pays for the average overall cost of providing essential health benefits to enrollees. These categories don't reflect the amount of care or quality of care provided in the plan. The category a consumer chooses impacts their premium costs and their total out-of-pocket costs. The percentages that the plans will spend on average are 60% for a bronze plan, 70% for silver, 80% for gold, and 90% for platinum plans. With a bronze plan, it's likely that a consumer would pay a lower premium, but they will pay a higher share of costs when they do get care. Generally, keep in mind that the lower the premium is, the higher the out-of-pocket costs will be for anyone on a plan. So the higher the premium with the plan is, the lower the out-of-pocket costs are going to be. This isn't the same as coinsurance, which is when you pay a specific percentage of the cost of a specific service. So if someone qualifies for Medicaid, Medicare, or the Children's Health Insurance Program, CHIP, the marketplace will let them know they're eligible and assist them in the enrollment office, the enrollment process. So you don't need to wait. No one needs to wait until October 1st to sign up in these programs. If they qualify for them now, they can sign up now. The enrollment period for the marketplace will never apply to these programs. In many states, these programs have expanded upon the signing of the Affordable Care Act. So even if someone didn't previously qualify, they could qualify now, or they could qualify on January 1st of 2014. So Medicaid's expansion is on a state-by-state basis, and an individual who makes up to 138% of the federal poverty level will qualify under the Medicaid expansion if it's in their state. Since it is not required that states implement Medicaid expansion, some are choosing not to. As of now, there are 21 states not moving forward at this time. All right, so this is a map that kind of demonstrates the status of Medicaid expansion in the U.S. So the lightest blue is for states that are currently not moving forward in Medicaid expansion. And the middle is for those that are moving forward. And the darker blue is for states that are still debating the expansion. Moving forward, we understand the importance of being able to find good information and answers to any questions that someone might have about this topic. Healthcare.gov is the official consumer website for the health insurance marketplace. It includes lots of general information, and it will be essential for October 1st. If you have any questions now, as a consumer, you can use the call center. It's open 24/7, and it should be able to handle any questions you might have about the marketplace. Their number is 1-800-318-2596. You can also sign up for email updates or text updates about healthcare expansion in the marketplace. Finally, consumers can sign up for an account now on healthcare.gov. It'll help alert you to programs that you could qualify for now, even though open enrollment for the marketplace doesn't start until October 1st. Another useful tool is the Kaiser Family Foundation's Premium Subsidy Calculator. What it does is it estimates what your premium subsidy might be. But please be aware that the subsidies it focuses on are not American Indian or Alaska Native specific. But it is a good start for understanding what your premium subsidies would be in regards to your income. Okay, so if anyone has any questions, that is our presentation. So the question that Kimberly asked is, so you can enroll now through Medicaid even if the marketplaces aren't open. How is this done? Through the regular old application? So if you go through healthcare.gov right now, you will be asked some basic information about your income, and it will set an alert and go, hey, you should be able to qualify for Medicaid. Here are the places to go for help. So it will forward you to who you need to talk to. So it'll forward you to the appropriate state website. But when the marketplace does open, if you qualify for CHIP or Medicaid or Medicare, you use the same application as you would for filling out any other healthcare that you would get through the marketplace. Anyone else? Okay, everyone, thanks for joining today's webinar, and if you have any questions or concerns, feel free to email me. And have a great afternoon, everyone. Bye.